Hello and welcome to Healthwire Media. Sneha Kumari with you, and you're watching our Facebook Live interactive session. We are in conversation with Dr. Shabnam Mir, who is a consultant physician and clinical head at Antara. This pandemic has been very difficult for us in one way or the other. We all have faced something or the other during this pandemic. But one thing which has been really great during this time is we have started taking care of ourselves and taking preventive measures at our home. So, welcome, ma'am, to Healthwire Media Live Interaction. Today, we are going to discuss about this topic, and we'll try to get your insights on this. So, first of all, ma'am, we want to know from you is that how has this COVID-19 pandemic affected the healthcare infrastructure in our country?
So Neha, I would like to initiate in this way that when the pandemic started across the globe, including India, none of the countries were really prepared to deal with such a huge health crisis. The major two factors which I feel which has impacted the healthcare infrastructures are mental and physical exertion of healthcare workers, and the second is backlog of all the hospital procedures. अगर मैं मेंटल और फिजिकल एग्जॉशन की बात करूं तो फिजिकल में आई फील दैट लॉन्ग वर्किंग आवर्स फॉर ऑल द होम हेल्थ वर्कर्स एंड अगर मैं सेकंड डॉक्टर्स एंड पेशेंट रेशियो, अगर हमने पैंडेमिक में हमने देखा होगा ड्यूरिंग द फर्स्ट वेव एंड द सेकंड वेव, बहुत जगह पे आपने सुना भी होगा कि बहुत सारे पेशेंट्स लोड बहुत ज्यादा है और डॉक्टर्स बहुत कम है. सो एट दैट टाइम ड्यूरिंग द सेकंड वेव आई वुड से the healthcare workers had to prolong their duty hours for 2-3 दिन तक ड्यूटीज करते रहे एंड डॉक्टर्स जो हैं, एक डॉक्टर जो है 40 to 50 पेशेंट्स दे वर हैंडलिंग इन दैट वे, राइट. सो दिस वाज द फिजिकल एक्सर्शन व्हिच दे हैव डील्ड एंड द सेकंड इज द मेंटल एक्सर्शंस. मेंटल एक्सर्शन में हम 3 पॉइंटर्स को हाईलाइट करेंगे. द फर्स्ट इज व्हेन द पेशेंट्स आर कमिंग टू द हॉस्पिटल but due to the severity of the disease and the doctors could not be able to save those patients. Second is refusal for the services. जब भी कोई patient hospital जाता है, bed नहीं होता, they have to refuse the patient. That basically have given a lot of mental exertion to all the healthcare workers. And the last very important step which I want to highlight is the healthcare workers themselves becoming COVID positive during the treatment of the COVID patients.
Yeah.
Right. So the second major impact on the health infrastructure is the backlog of all the clinical procedures. आपने देखा होगा कोई भी पेशेंट है जिसको हॉस्पिटल जाना है फॉर फॉलो अप फॉर कोमॉर्बिडिटीज, उनको कोई बीपी है, शुगर है, दे हैव टू गो फॉर द फॉलो अप चेक. बहुत सारे पेशेंट कीमोथेरेपी करवाना चाहते थे एंड बहुत लोग ऐसे भी हैं जिनको ब्लड ट्रांसफ्यूजन चाहिए था, but they also opted to minimize themselves at home only because they were also in a risk of getting the infection from the hospital. तो उन्होंने भी घर पे ही प्रेफर किया and from there they prefer to get home healthcare services. So these are the two major factors which I feel has impacted the healthcare.
Now, one thing which has been really difficult during this time is that ये बच्चों के लिए और senior citizens के लिए pandemic बहुत ही ज़्यादा problematic और we can say kind of difficult रहा है. बच्चे घर से नहीं निकल सकते या हमारे senior citizens घर से नहीं निकल सकते. तो इसके regarding I wanted to know that how are home care services boom for senior citizens, especially during the second wave when the positivity rate or the
I think Sneha, very good question. I have just mentioned this before also कि जिन भी लोगों को हॉस्पिटल जाना था due to hospital procedures or for the follow-ups, they opted for home care services. Yes. Definitely वहाँ पे अगर हम देखें तो home care services has emerged as a booming industry in the second COVID wave when the positivity rate was very high. So as Antara की बात करूँ तो we have served hundreds of patients who were mild symptomatic of COVID, and we have supported also hundreds of patients who were moderate to severe, and due to unavailability of the beds at the hospital, they were supported at home. तो उस तरह से अगर हम देखें तो हमने हेल्थ इंफ्रास्ट्रक्चर को होम केयर सर्विस ने एक तरह की हेल्प की है. फर्स्ट इज दे हैव हेल्प टू कंटेन द वायरस. जितना वो बाहर जाएंगे उतना वो वायरस रेप्लिकेट होगा. तो कंटेन वायरस की वजह से पॉजिटिविटी रेट भी कम हुआ है. घर पे ट्रीटमेंट की वजह से हॉस्पिटल का बर्डन भी कम हुआ है. एंड द थर्ड इज we have saved many lives also by treating and supporting that at home. उसकी वजह से हमारा जो मोर्टेलिटी रेट है जिसको हम कहते हैं मृत्यु दर वो कम हुआ है. और इस तरह से हमने पूरा we have supported this in home care sector.
Okay. Okay, taking from that, ma'am, I would like to know that, and our viewers also would like to know that, what are the various tests and facilities one can get at the comfort of their home?
अगर अंतारा की बात करें तो I don't know about the other healthcare providers.
Yeah.
I was just focused on the Antara only. Yeah. So Antara provides the whole set of home care health services under one roof, right from diagnostic to ECGs, X-rays, manpower, like nursing caregivers, patient caregivers, equipments, doctors, isolation packages. So we are providing all these kind of services at your comfort at home.
Okay. One more thing which is very interesting, I feel that ये सवाल बहुत ही ज़्यादा मुझे लगता है हमारे viewers को भी काफी interesting लगेगा, that how are the X-rays and ECGs conducted at home? What is the procedure? Because बाहर तो हम देख सकते हैं कि हमें पता है कि facilities are available, but at home how is it done?
So, Sneha, I would just like to highlight that X-rays and ECGs which are conducted at home are the same which are conducted in the hospital. Only there is a difference in the X-ray machine which we are using in the hospital is the bigger machine, and which we are using at the home care setting, that is the portable machine. But the ECG machine which we are using in the hospital and the home care setup are both same. Fine. Secondly, we have a designated team who is doing all these procedures, and this team is specially trained for these procedures.
Okay.
And we make sure that all our team members are following all the infection control and COVID protocols, which includes PPE kit, mask, gloves, face shield, so that if they are they avoid to replicate the virus.
Yes.
Second, our team members are fully vaccinated who are going for both these procedures. Third, all our equipments which are being used on the patients are being sanitized after each use.
Okay, and I think इसमें लोगों को काफी एक thought process आएगा that how safe it is, like if it is being done at my home place or at my home, how safe I am, like how safely it is conducted.
Definitely, if we talk about the infection control protocols, it is 100% safe. Second, we follow all the standard operating procedures which are to be followed for each X-ray and each ECG. There are certain contraindications. कुछ चीजें ऐसी होती हैं जिसमें हम एक्सरे नहीं कर सकते हैं, तो उससे पहले हमारे जो टीम मेंबर्स हैं they take all the history of the patient, like उनके घर में तो प्रेग्नेंट लेडीज तो नहीं है, या जिसका एक्सरे हो रहा है वो प्रेग्नेंट तो नहीं है, because these are the tests which जो पेशेंट खुद से भी करवाते हैं and किसी के प्रिस्क्रिप्शन पे भी करवाते हैं. So that screening is being done before giving any sort of service.
Okay, and how accurately or how accurate is the result or the reports are, or how accurately it is done?
So I think accuracy is same as a hospital. Definitely, it is more beneficial because in this COVID, nobody wants to go outside and get infected. And I have not, I don't even feel that there is any inaccuracy in the procedures in the home care sector.
Okay. And one thing more that is very important for everybody to know from this video or from this interaction is that when and how one should call for home-assisted services such as X-rays or ECGs.
See, in van, if I will say, van has two categories. Van में एक होता है कि patient खुद से करवा रहा है, patient गिर गया है या patient को खांसी है, he is or she wants to go for these tests. एक ये हो गया. और दूसरा वैन हो गया जब वो किसी डॉक्टर के पास जाते हैं और डॉक्टर उनको बोलता है कि ये आप टेस्ट करवा लो. So these are the two scenarios where these tests are done. Second is how they can approach us for the test. I think we have the toll-free numbers and customer care numbers. One can approach easily there and get the slots booked for this test.
Okay. Okay, ma'am. And I also want to know that how has this idea come to your mind about home, X-rays and ECGs to be done at home? Like, this was due to this pandemic or before also you had this?
We were doing this procedure before the pandemic also. And
Okay.
we have we are into elderly and senior livings. So every seniors wants this procedure to be done at the comfort of their home. They want to do at home only.
Hmm.
So of course, pandemic has also boosted up for these procedures, but we were doing before also.
Okay. And how many people are coming up to you, and how many, like, is it becoming a trend in in our healthcare sector now? Like in India,
I didn't get your question.
how many people are actually using this facility currently?
So it's very difficult to give you the numbers,
Yeah.
how many people are using, but definitely we are getting a lot of calls for these facilities, for getting these facilities.
That means people are like, kind of using this and they want to use this facility.
They are aware of this facility.
Okay, okay. Okay, ma'am. And anything which you would like to add about the COVID-19 pandemic, or for our viewers, any preventive measures you want to share uh, for our viewers to know about?
So definitely preventive measures, I would like to highlight that those virus is still here. Be at home, wear mask, and avail the services as much as you can at home only, rather than going to the hospitals. Till we are not COVID free.
Okay. Okay. And also, ma'am, one thing which came to my mind right now is that other than ECGs and X-rays, are there any other tests which test facilities which Antara is going to provide, or is
Definitely, definitely, we have all sort of blood investigations which we can do at home care settings. All the approximately all the blood tests are being done in in the home care settings.
Okay, and it is also done in the same.
We also do Holter monitorings. It's a device which is being fixed on the body, and it will record your ECG for 24 hours or 72 hours. We do that also.
Okay, and it is also done in the same procedure as it is done in.
Yes, it is the same procedure are being followed. This is a fixed device which we are fixing on the patient's body, and we have to be. It has to be there for 24 to 72 hours, and then the technician goes, of course, with all the infection control protocols, and then take out the device and give the reports.
All right. Okay, and then this is kind of, we can say that this is kind of becoming a part of teleconsultation, which we all are following right now during this pandemic, and it has also become a very helpful facility for all of us. Okay, so I think that's all our set of questions, and anything else you want to add and to say to our viewers about it, you can add.
Anyone has questions, we can ask.
Yeah, I'll just check with our viewers. Okay, ma'am, anything else do you want to add for this pandemic? You can keep on adding, and you can say about it to our viewers, so that meanwhile I'll just check the questions.
I think about the pandemic, I would like to say to all the people, get vaccinated. Vaccination is very important, and definitely it will protect you from the virus.
Okay. Okay. All right. And what are the preventive measures you people take on your side when you go for such kind of tests, or any, this facility provides? What kind of preventive measures do you take?
You mean to say when our technician goes for this test?
Yes. Yes.
I have already mentioned that all our technicians, we work on the safety of both the ways. The patient should also be safe, and our technicians should also be safe. So our technicians are fully vaccinated. The first thing, they wear fully PPE kits. All bodies covered with the PPE kit, right from mask, face shield, gloves, and gown, and that's it. They have to protect two ways. They have to protect themselves also. They have to protect the patient also.
Yes, yes. Okay, ma'am, I think I have got one question. I think it is not related to the topic, but then just being.
I try to answer.
Yeah. So it's from Mishra Mainka. She is asking that I have a massive hair fall after COVID. And is it normal, or should I go for medication?
Ma'am, I think this is a very normal complaint which all the patients post-COVID, says that there's a hair fall. So this is only a post-COVID symptom. I would request them to wait for at least 3 months and then take a second call.
Okay. I think you, Mishra, Menika ma'am, I think you got your answer. We are waiting for some more questions. If you have any more questions, please you can ask in this live. You can put your questions in the comment section. Ma'am, anything else do you want to say about Antara during this live?
If you want to know about the Antara is basically into two verticals. One is the home care vertical, and the second is the home care homes verticals.
Yes.
So care home is our assisted care facility, and the facility where the elderly and people who needs rehabilitation can stay for long term or for short term and get the comfort of their home.
Yes.
So this is the one vertical. Right now we have two facilities. One is in GK and one is in Gurgaon. And second vertical is, of course, we are discussing the home
preventive. Yeah. Okay. There's one more question from Narendranath Mishra. जी, he's asking that कोविड के टाइम में कोई टेस्ट करने से पहले क्या और कॉशन करना चाहिए, कोई और प्रिकॉशंस लेने चाहिए हमें?
टेस्ट करने से पहले प्रिकॉशंस तो सर कुछ ऐसा नहीं है. अब कोविड हो गया है तो मतलब प्रिकॉशंस नहीं लिए गए हैं, इसलिए कोविड हो गया है. राइट. तो टेस्ट के लिए डेफिनेटली एक बार पेशेंट की पूरी हिस्ट्री चाहिए होगी, विच ऑल टेस्ट नीड्स टू बी डन. मैं ये नहीं कहती कि रैंडमली आपका कोविड पॉजिटिव है तो सेकेंड डे आप सारे टेस्ट करवा लो, बट देयर आर स्पेसिफिक टेस्ट टू स्पेसिफिक इंडिविजुअल्स. अगर कोई इशू है तो देन ओनली अकॉर्डिंग टू दैट राइट द टेस्ट.
ओके. ओके. Second question here, I think Harsh Sharma is asking that how safe is an X-ray conducted at home and how accurate is an ECG done at? I think the same question Amrit Oja is also asking, that how accurate would be the reports of the test done at home.
I think I have already mentioned this answer. Accuracy में तो कोई doubt नहीं है. It's the same machine which are using in the hospital and same machine we are using in the home care setup. Only it's a portable machine. That is the only difference for X-ray. But the accuracy is 100% same which we are getting in the hospital and at home. There is no difference in the accuracy. Definitely वो कैसे करते हैं X-rays and all that. अभी मैंने थोड़ी देर पहले भी मेंशन किया था कि हम इन्फेक्शन कंट्रोल प्रोटोकॉल्स को पूरा फॉलो करते हैं, एंड वी टेक ऑल फॉलो ऑल द स्टैंडर्ड ऑपरेटिंग प्रोसीजर्स रिगार्डिंग इस एक्सरे. किसी पेशेंट को हो सकता है कॉन्ट्रा इंडिकेशन हो, हम एक्सरे नहीं करवाना, उसमें नहीं होना चाहिए, एंड जो अपनी मर्जी से एक्सरे करवा रहे हैं तो हम पूरी हिस्ट्री लेके एंड देन वी डिफाइन वेदर वी हैव टू गो फॉर दिस प्रोसीजर और नॉट.
Okay. Other than that, there is one more question from Shobha Mishra. She's asking that COVID के time क्या full body checkup करना चाहिए? As you said, I think you have answered this question. So,
ma'am, I would not recommend कि full body checkup करवा लो. Wait for your physician to guide you कि कौन सा टेस्ट करवाने हैं. हमने बहुत सारे पेशेंट्स में देखा है कि उनको कोविड होता है, वो सेकेंड डे सारे टेस्ट करवा लेते हैं. There is no point of doing all the tests on the second day. आपका फिजिशियन ही बेस्ट आपको उसका आंसर दे पाएगा कि जो भी टेस्ट करवाने कितने टाइम इंटरवल के बाद करवाने आपको पॉजिटिविटी तो कौन से टेस्ट करवाने. डोंट गो फॉर ऑल द बॉडी चेक.
Okay. One more question we have over here. It's from Ramanath Mishra ji. He is asking that how can we perform COVID test at home and what is the procedure?
So COVID test first of all आप परफॉर्म नहीं करेंगे, एक टेक्नीशियन आएगा जो भी परफॉर्म करेगा. डेफिनेटली टेक्नीशियन जो है यू कैन बुक दिस कोविड टेस्ट ऑन आवर कॉल सेंटर एंड द टेक्नीशियन विल गिव यू द कॉल एंड टेक ऑल योर डिटेल्स, जिसमें कि आजकल आपको पता ही है आधार कार्ड एंड ऑल दैट को लगता है, एड्रेस एंड एवरीथिंग, एंड ही विल कम टू योर रेजिडेंस एज ऑन द allotted time. And it can be done. I think COVID test तो it's basically a swab test. We have to take two samples, one sample from the mouth and one sample from the nose.
Okay.
This is how it is done.
Yeah. Ma'am, there is also one thing that जो आजकल जो COVID टेस्ट किट्स, सेल्फ टेस्ट किट्स जो आई, तो उसके लिए प्रोसीजर्स काफी सारे हम देख रहे हैं, यूट्यूब पर भी प्रोसीजर वीडियोस बन रहे हैं. So how should we go for it or should we just follow the?
I think जो सेल्फ टेस्टिंग किट्स आई हैं, that उसमें अगर पॉजिटिव आता है तो इट इज अ ट्रू पॉजिटिव इफ यू कंपेयर विद आरटीपीसीआर. बट अगर उसमें नेगेटिव आता है तो समटाइम्स उसमें फॉल्स नेगेटिव भी आता है. दैट इज नॉट अ एक्यूरेसी टेस्ट, दैट इज अ स्क्रीनिंग टेस्ट बेसिकली. हम स्क्रीन करते हैं उसको. अगर एक्यूरेसी आपको चाहिए, डेफिनेटली वन शुड गो फॉर आरटीपीसीआर.
Okay. A lot of questions are there regarding the precautions which people or the when the X-ray is done of anything. What are the precautions you guys are taking? There are a lot of questions in my comment section which I can see about the precautions.
I think precautions. So, precautions in the way they want to ask what are the, definitely again I think the same answer. Infection control, precautions. कि उनको ये डर है कि हमारे टेक्नीशियन की वजह से उनको कोविड ना हो जाए, right? This is what they want to do. Definitely. इसका आंसर मैं पहले भी दे चुकी हूँ. They wear PPE, they are vaccinated, they are disinfecting all the equipments before any procedure. हर एक इंसान को जब हम एक्सरे करते हैं तो नेक्स्ट के जाने से पहले हम डिसइंफेक्ट करते हैं.
Right.
We don't use the same.
There is one thing. Rajat Yadav ji is asking that how can we protect our grandparents from the third wave? What do you want to say about it?
The first thing I would say, vaccinate them and try to contain yourself at home as much as possible. वायरस अभी यही है, वायरस अभी गया नहीं है.
तो आप सब precautions जैसे ले रहे थे, wear your mask and get vaccinated. That's very important. Okay, I have one more question that says, this from Mohit Mehta saying, what are the symptoms of long COVID?
Long COVID की अगर बात करें, that means you are recovered from the COVID and you have symptoms, right? तो उसमें सबसे पहले मैं जैसे अभी व्यूअर्स ने मुझसे पूछा कि हेयर फॉल is also a symptom of long COVID.
जी.
हमने बहुत सारे पेशेंट का देखा है कि सीरम थायराइड लेवल डिटीरिएट करता है when they go for testing. उन पेशेंट में बहुत ज्यादा चांसेस होते हैं कि हेयर फॉल होने की. सेकेंड इज मेंटल एग्जॉशन. अभी मैंने इसके बारे में अभी थोड़ी देर पहले भी बात की. बहुत सारे पेशेंट्स हमें बोलते हैं कि कोविड के बाद हमें नींद नहीं आ रही, हमें बहुत ज्यादा लेथार्जिक लग रहा है, या फिर बहुत ज्यादा मतलब दे आर वेरी अनईजी. तो कहीं ना कहीं कोविड तो मेंटल हेल्थ पे भी इफेक्ट करता है. एंड द लास्ट थिंग आई वुड से, बहुत सारे लोग मेमोरी रिलेटेड इश्यूज भी बताते हैं लॉन्ग टर्म कोविड में. बोलते हैं हमें हमारे थोड़े से ना लाइक वी आर नॉट एबल टू फोकस ऑन द थिंग्स, या फिर हमारे कॉग्निटिव स्किल्स थोड़े इम्पेयर्ड हो गए हैं. तो उनको हम ये बोलते हैं कि एंगेज योरसेल्फ मोर एंड मोर इनटू गेम्स, ब्रेनस्टॉर्मिंग गेम्स आई कैन से, जिसमें कि आपका ब्रेन स्टिमुलेट हो एंड तो स्टिमुलेशन की वजह से ब्रेन जो है वापस नॉन कोविड स्टेट में आ जाए. दीज आर द सिम्पटम्स वी आर फेसिंग.
Okay. There's one more very interesting question that I can see is from Ramanath Mishra ji. He's asking that is CT scan safe for COVID test? Because this has been a topic of discussion few months back.
I think I don't want to go for a CT scan initially. जैसे आपको पता है कि डिजीज का पूरा जो पीरियड है 1 to 14 days है, right? So we should not jump on the CT scan on a very first day, because आपको पता है कि CT scan is like उसमें exposure ज़्यादा होता है. And CT scan is only done when to see the severity of the disease. पहले तो हमें ये देखना है कि हमारे लंग्स पे कितना अफेक्ट हुआ है कोविड की वजह से. So simple X-ray is the first tool which we should use. अगर हमारे एक्सरे में कुछ आता है कि भाई इसको नमोनिया हो रहा है, लाइक द डॉक्टर फील्स के नमोनिया ज्यादा है, देन दे हैव टू सी कोविड में नॉर्मली ही नमोनिया होता है. लाइक वी विल नॉट से कि कोविड का कोई भी एक्सरे नॉर्मल नहीं होगा, थोड़ा बहुत नमोनिया आएगा ही आएगा. So some doctors take a judgment and they ask a CT scan only to know the severity of the pneumonia. Otherwise अगर आपको छोटा मोटा नमोनिया आ रहा है, I don't think so there is any requirement for doing the CT scan.
Okay.
X-ray is enough.
Okay. I think there's also one question that says that is sore throat a COVID symptom? I think this is very.
It's a very controversial question. Sore throat can be a COVID symptom, but sore throat can be a normal sore throat also, pharyngitis, tonsillitis. So COVID में basically fever होता है, sore throat होता है, and fever also high grade fever.
So how do we differentiate between a COVID sore throat and a normal sore throat?
कोविड में ना सिर्फ sore throat नहीं होता. We don't have patients जिनको सिर्फ sore throat है and they are COVID positive. We have patients who are totally asymptomatic. इनको कोई symptom नहीं है, and we have patients who have sore throat, who have mild, उनको low grade fever होगा, body pain करेगी. So only sore throat I don't feel it's the symptom of COVID.
It can be also if it is persisting for a long time, maybe.
Correct.
And if we don't have any fever or anything but the sore,
could be a chronic pharyngitis. उसको पहले भी होता होगा, seasonal हो सकता है. Maybe लोग ठंडा पानी पीते हैं आजकल ज़्यादा, तो उसकी वजह से हो सकता है. But it is not always COVID.
Correct, correct. And we always get confused because me myself always I'm in a fear state that if it is not COVID or I'm just why it is a sore throat.
So sore throat is always associated with other symptoms also, not only sore throat.
All right. Okay. I think that's all I have in my comment section. I cannot see any more questions. I think that's all. So thank you so much for joining Healthwire Media, ma'am, and giving so many insights on this topic and COVID-19.
Thank you, Sneha. Thank you so much.
Thank you so much for joining Healthwire.